Hello, Dominica. Good evening, everyone, and thank you for letting me join you on this very special occasion. Unfortunately, I was not able to travel, and I'm reaching out to you from the United States. Kellen George has asked me to speak at our ceremony about my organization, Save Against Sickling, the Island Project, and the work that was involved in making the donation tonight happen. Although the official beginning of my nonprofit was only October of 2014, the inspiration for the Island Project was sparked over 4 years ago during a biochemistry class on Ross University's medical school campus. Dr. Meisenberg was giving his traditional lecture on sickle cell anemia, by which he invites a guest speaker to tell us their story on how the disease has affected their lives. I remember sitting amongst 300 or more medical students, but feeling as though he was only explaining his struggles to me. His pain, his hospital visits, insecurities, daily obstacles, and of all his hope taught me more about sickle cell anemia than a textbook ever could. The gentleman had specifically described a situation where his crisis was so bad and his blood numbers were so low that he would need a blood transfusion. It was not available. He did not get one. Not only as an inspiring doctor, but as a human, I wanted to know how I could help. During my studies in Dominica, I had brought up the possibility of a blood drive. My small gestures to Dr. Meisenberg, a campus organization called Salabia Mission Project, and to some of my colleagues was encountered with the impression that it would not be a simple task. So I let it go and continued to focus on medical school. 3 years later, I was 1 year into my residency training to become an anesthesiologist. I am, overworked, underpaid, sleep deprived, and wondering if I was truly making any difference in this grand universe. As I searched within for an answer, I was reminded of my experience in Dominica and decided to pursue a charitable cause. It was not an easy accomplishment. In fact, it was extremely difficult. Even with the help of my 3 best friends from medical school and my 3 lifelong friends, I had no idea what I was doing. I was a doctor, but in order to make this accomplishment, I had to be so much more. I had to be a tax accountant. I had to actually create a federally approved nonprofit organization that allowed donors to be tax exempt. I studied hundreds of pages written by the IRS and researched tax-related terminology. And somehow within 1 year national backlog, my application as a nonprofit was approved in 3 weeks. I had to be a graphic designer. I taught myself how to create a website, accept donations online, and advertise Save Against Sickling. I had to be an event planner. I organized fundraising events, planned health fairs, collaborated with restaurants, social media to create an occasion that would entertain my donors and still spread my message. I had to be a product investigator. I compared several companies for the best blood refrigerator in terms of pricing, delivery, capacity, and quality. Last but not least, I had to be a businesswoman. I contacted Ross University hoping that they would want to help an alumnus that wanted to give back to Dominica. I was blessed with the incredible deal of a $2 donation by Ross for every $1 I raised on my own. When I reached $5,000, Ross kept their promise and donated $10,000 and gave us a chance at making the Island Project more than just a vision, but a reality. Even with all those challenges conquered, we probably would not be here at this ceremony tonight without Miss Kellen George and her efforts. I wanted to get in touch with somebody who was as passionate as I was about bringing a blood refrigerator to Dominica and ultimately holding a blood drive to help sickle cell anemia. I read about her foundation and emailed her in the summer of 2014. Less than a year later, we have made the donation a reality. I'm thrilled at what we have done and what there is in store. Save Against Sickling will be organizing the blood drive and putting the refrigerator to use. One blood drive will be hosted on Ross University's campus to allow the medical students and faculty to give back to the community around them. I hope you'll be present for the blood drive. We're also currently talking with Dr. Stanley White about setting up a regular sickle cell anemia clinic where medical students could get practical experience and the patients could benefit on a regular basis. I plan to continue sponsoring Sickle Cell Cares Foundation at their events and efforts to increase sickle cell anemia awareness. Thank you for being here. Your support is tremendous and necessary to make a difference. Thank you for having me. After spending 16 months living in Dominica, it is my honor to be able to give back. I will leave you with my favorite concept. You must see the world in order to change it. I hope you enjoy the rest of the ceremony and happy International Sickle Cell Day.